Hi guys! Welcome to the first installment of Jillian's Clinical Corner. Each week we will cover one topic and discuss the best practices for teaching the skill. So today's topic is waiting. All right, so first, why do we teach waiting and what is the terminal goal of this program? So we teach waiting to wait for items, to wait for attention, wait for activities or appointments, wait for something tangible, a reinforcer, or something that was requested. Ultimately, we are almost always waiting for some sort of reinforcement. So even though waiting for an appointment or waiting in line isn't necessarily the reinforcer, being done with that appointment or moving forward in the line and finishing that task may serve as a reinforcer. So the biggest one here seems to be attention. You most likely are waiting for attention from a peer, a spouse, a parent. For some of our learners, attention can be extremely reinforcing, and more so when that attention is divided. So as soon as mom takes that phone call, the child may want her attention even greater than when mom was available for the attention. So then, of course, when she hangs up, the attention may be less reinforcing. Individuals need to be taught to wait as a delay tolerance, and so they can wait appropriately when times require it. And it's actually required quite often to wait appropriately. So it is a very appropriate skill for our learners to learn. The terminal goal here would be that an individual can wait an amount of time, which may be known or unknown, in an appropriate way until the item, activity, or appointment or the person's attention can be accessed. Sometimes waiting is indefinite. If I'm waiting to go to Disney World, I might be waiting for 5 years or an indefinite amount of time, maybe to save money, maybe until a child's parents want to take them. Sometimes waiting is immediate though. So if I'm waiting for the TV to turn on, as soon as I press the on button, turns on and my waiting is very short, 5-10 seconds. Usually waiting is somewhere in between here though, waiting between 10 minutes to an hour, for someone to get home from work, to go out, or to get their attention, the time to go to the movies or to the store, the time for dinner. It's usually in that middle ground that's most appropriate for individuals to wait. So what are some ways in which waiting is taught? So sometimes waiting is taught by our clients standing on a square or a mat and then cutting that mat down systematically until the square is faded and our clients are able to wait in one designated spot. The reason for waiting in this way would be teaching waiting in a line or in a public space where movement around the area wouldn't be appropriate. Sometimes we teach our clients to wait sitting down. This could be used to teach something like waiting in a waiting room for an appointment. And then there's times we might teach our clients to wait for a requested item or for attention. So once the request is made by our client, we tell them, okay, wait. And they might wait 5 seconds in the beginning, and then that time would be built up to a minute, 5 minutes, 30 minutes, however long, is our goal. The question I think here for all of our waiting skills is, what are our clients doing while waiting? Even though all of those are appropriate ways to teach waiting, what are we having our clients do? So sometimes programming includes waiting with hands down in the absence of motor or vocal stereotypy and in the absence of talking. This might be appropriate per learner depending on the level of motor and vocal stereotypy and the conversational skills. Oftentimes our clients, I think, are kind of waiting for almost no purpose, for nothing specific. So maybe they're just waiting in the name of teaching waiting as a skill because that's the programming. and not always waiting for a designated item. So even though you might not always exactly know what you're waiting for or how long you're waiting, I think it's best to share with our clients that they're waiting for something. And as far as motor and vocal stereotypy, this is, like I said, very learner specific, because each individual person might have some level of stereotypy, maybe tapping your hands, moving around the area, although depending on the level, those could be inappropriate in some settings. So what are the best practices to teach waiting? So I would say first, think about the way in which we wait. Would you ever wait with nothing to do in the meantime? We usually always have our phones, person near us for conversation, music, a magazine, even an old one at the doctor's office would do, a TV to watch. Like I said, even an old sitcom at the doctor's office would most likely entertain us. We would usually always go to an appointment or someplace where we know we'll be waiting with something to do, or even find something to do while waiting there. Some people are very restless while waiting and walk around in the hallway or in the waiting room. Even if you're just waiting 5 minutes for someone to hang up the phone, it's unlikely you're waiting and doing nothing. You're probably playing on your cell phone or at least tapping your fingers. Couldn't tapping your fingers even be considered a small amount of motor stereotypy? So all of these things considered, it's very important for us to give our learners something to do and have them know what they are waiting for. But what does the research say? So honestly, there isn't a lot of clinical research on this. There is actually a lot of basic research, but it hasn't been applied frequently to clinical practice. So there are a few studies on teaching self-control and tolerating a delay to earn a larger reinforcer, but this is really a discussion about teaching waiting. So there were 2 studies that I wanted to highlight. Newquist, Dozier, and Nadart, 2012, found that providing preferred toys during the delay, or the time spent waiting, effectively enhanced self-control or the ability to wait appropriately. So I think that's so important. They found that the clients waited, or the individuals in their research waited better because they were provided with preferred toys during that delay. So I think that's so important, and that really speaks to us giving our clients something to do while they're waiting to entertain themselves. Even if it's something preferred, maybe not their most highly preferred reinforcer, but something preferred, or even if they are waiting for an activity to begin and they're doing work with you, they're still exhibiting that waiting skill as long as they are working without problem behavior. The second study is Vollmer, Borrero, Lally, and Daniel, 1999. They found that participants displayed self-control, or the ability to wait, when the delay to reinforcement was signaled with a hand or gesture or a timer. So here they are saying, let your clients know how much time they're expected to wait. For us, like I said, sometimes we don't know exactly how long we're going to be waiting. If we're in a long line, if you're at the DMV, if you're at a doctor's appointment, you don't always know. But in the beginning of teaching the skill of waiting, I think it is important to let your client know how long the waiting expectation is, with a timer, a hand gesture, tokens, something to clue them in on how much longer they will need to wait. Also, these references are available in case you're interested in reading the whole study for them. So, what's the takeaway here? I think it seems like research shows we should let our clients know what they're waiting for, so make waiting purposeful, and provide an activity for them to do during the time spent waiting, and signal for them how long they are waiting. Now, of course, all of these things are going to be learner specific. So all of these recommendations are not necessarily going to fit every learner that you have. If you have a client who maybe perseverates on time, maybe watching a timer countdown might not be as appropriate. But apply these to your learners as well as you think you need, as appropriate as it is. As far as should they engage in stereotypy while waiting, well, there was no research that I could find on this. I would say the best advice would be this would be learner specific. So it's too hard to say always do this or always do that. This is really learner specific, and it's whatever is appropriate for your learner in the community or in the area where they're going to be waiting. Thank you so much for joining me for the first installment of Jillian's Clinical Corner. If you have any suggestions or research topics or interests or things that you would like to discuss best practice of, please send me an email and let me know. We will be discussing it first on the group collaborative call, and then I will do a clinical corner for the best practices of that topic. Thank you so much.